So here is a snapshot of what is happening right here in our own community. The story I'm going to tell you is fictional, but is based on real cases as a combination of what we are seeing during the course of investigations. It is not story of one person or a family, but of many combined. The nights are still cold, snow has melted away, trees remain bare, an old couple sitting at the dinner table across from each other at their home. Wife asks husband, "How are you, honey? You have hardly touched any food." "I don't feel good," he replies. "Why?" "I don't know. My chest hurts and I'm short of breath." "You were coughing all night and felt warm," wife added with a long pause. "Yes, my head hurts too, and I'm aching and nauseous. I can neither smell your cooking nor taste it." He jokes and says, "Honey, have you lost your cooking skills?" They continue to struggle through the evening. He could not eat much and went to bed feeling sick. Woke up with worsening symptoms and was taken to the local hospital by the ambulance in the morning. He was diagnosed with COVID-19 and transferred to the intensive care unit of that hospital. Wife did well for a few days, and then she developed symptoms, which continued to get worse, and she ended up in the hospital as well. She remained on the regular medical floor for now with the diagnosis of COVID-19. After 41 years of marriage, they were in the same hospital, under the same roof, but could not see each other. They don't know what happens next. While this is happening, the community already had more than 100 cases, and press briefings were happening every day, like we do it here. Few days before this, their eldest son, who lives nearby, who normally checks on them on a regular basis, visited them, which he normally does. He wasn't feeling well for last few days, felt achy, tired, some minor cough, loss of taste, thought it was a cold, and he thought, oh, he's working long hours in past few months, and it must be the case. So he spent few hours with them along with his youngest son, who was coughing and sneezing as well. After parents were hospitalized, son continued to get sicker for the next couple of days and then started to improve. He continued to work, except over the weekends. When he was off, during this time, he kept up with his social circle. The son, that means the grandson of the elderly couple, improved through now son's wife is quite ill. 3 other children in the house of the son are well. An elderly couple's son who also noted that some of his close friend, who he played cards with few days ago in one of their homes, are ill. He also heard from his coworkers that they are having symptoms similar to his. He also attended a potluck for volunteers to support them in a goodwill, and is now concerned about them. So he was watching TV, reading newspaper, getting information from the Facebook, Twitter, and learning about the new COVID-19, and finally decided to call his doctor and took a test. By the time his symptoms have almost resolved, 48 hours later, he gets a call from the health department. "Hey, this is health department, your test is positive," and start the investigation. During all this time, many other people got exposed to him and now are sick. So when you ask, who are these people? They are families like your and mine. Mom, dad, children, grandparents, friends of friends, and neighbors. What do they do, you ask? Many of them work in our community, from the health system, grocery stores, laundromats, food workers, and many more. How are they doing? We give you data every day, hospital data. How many cases we have? You get that here every day. Where they possibly might be living. What would COVID-19 going to impact our family and neighborhood? You can look at the map updated daily. All of this is possible only because of many dedicated public health staff of Onondaga County Health Department who are working 7 days a week, long hours, to identify these individuals who are tested positive for COVID-19 and are considered infectious. They can transmit the disease to others. It is crucial to identify their friends and family members and coworkers to ensure that we can provide guidance, how to quarantine themselves, and monitor for any signs of sickness. I can tell you this today because I'm looking at these cases. Data comes from people, and every data point is a person. We should never forget that. Remember, many of those who are getting sick during those quarantine time and had hunkered down in their rooms, apartments, and houses, they were able to prevent many more cases in the community. I know it was not easy for them to do, but they did it because they want to protect others. Because this is one of the most important and crucial steps in dismantling the path of this virus. As these individuals developed symptoms during their quarantine, but they were able to stop the path of the virus because they stayed down. I really, truly want to thank them from the bottom of my heart. Their selfless act of giving up their personal freedom to save others and accepting quarantine, they actually protected others. And that brings a lot of joy to me personally during this difficult time, and which is unprecedented time, you all will agree. Every selfless action protects health of others, and we continue to work in this uncharted territory. I want to thank all those. And all of this work to prevent transmission of COVID-19 is possible, as I mentioned, with the everyday's tedious, painstaking work of our health department staff. You are getting truly a virtual picture of impact of COVID-19 in our community every day. This is a Public Health Week, and I want to recognize all my staff in front of you who are working every day, long hours, to protect health of our community. I want to thank them because they are unsung heroes of this public health crisis in our community, and without them, we would not have all this information which is guiding the public policy at the local level, whether school closures, stay-home orders, and many more. And lastly, I'm humbled to serve in this role as Health Commissioner under the County Executive, Ryan McMahon, who has been a champion of public health and have put forward strong policies with one and only one goal, to protect health of the community. Thank you.
Thank you, Dr. Gupta. This is Public Health Week, and saying that, Doctor, to recognize you and your staff, I brought you some flowers. Normally I would give you a hug, but that's not allowed. So thank you for everything you've done. You are remarkable, and we are very lucky to have you, and your team is remarkable. To give everybody context to what Dr. Gupta is saying, they're going to be working on Sunday. They're working Saturday. They're working Friday. For many of us in various religions, this weekend's some of the holiest days of our year, and Dr. Gupta and her team are going to be working, doing just that, helping our people who are sick get better and helping to quarantine. And that is critical in this process. So, Doctor, thank you again for everything you've done, the amazing work, and that you'll continue to do for us in our community.